you. As Leah said, I'm Dr. Ali Baird and I work at Enkish. And I was recently involved as in the Greater Manchester Don't Brush It Under the Carpet campaign, which was a campaign trying to reduce self-harm in older people. So first one, I'm just going to give a quote from our Professor Nav Kapoor at Enkish. We sometimes think of self-harm as a problem in younger people, and of course it is, but it affects older adults too. And the concerning issue is the link with increased risk of suicide. Older people might be particularly vulnerable as they're uniquely exposed to issues such as bereavement, isolation, and physical as well as mental illness. And this was something that was really pertinent during the pandemic with the bereavement, isolation, and physical illness. And this is why Greater Manchester Suicide Prevention Programme Board made self-harm in older people a priority. This was funded by Greater Manchester Mental Health and Social Care Trust, and they built on the work of the Shining a Light Suicide campaign, which is led by Adele Owen. Along with other experts in the field, we worked with the Greater Manchester Old People's Network to co-produce an awareness campaign. And I just want to highlight the ethos of the Greater Manchester Old People's Network, because this is really important as part of this campaign, and also really important when you're actually working with older adults to involve them. This is a Greater Manchester Old People's Network pride themselves on being led by older people. They pride themselves on being age proud and also being representative and inclusive. So with this in mind, this is what we based our campaign upon. The aims of the campaign were to reach and support older residents and guide them to the right support for them in Greater Manchester. We also wanted to raise awareness of the issue in self-harm in older people amongst carers, family members and health professionals to enable them to support individuals who might be struggling, and also to raise awareness in the community, also among young people who might have contact with older people, in order to reach out and help them when they need support. As I said before, the Greater Manchester Old People Network were crucial as part of this campaign for co-production. There were members of the Greater Manchester Old People's Network in our working group, and also we held 2 focus groups with members of the Greater Manchester Old People's Network. As part of that focus group, we thought it'd be really engaging to use a cartoonist, just to give a creative approach and also to see what came out of the cartoons and whether that could be used as part of the campaign. In focus group 1, there were things that came out of it were to have a positive focus, to represent older people in a positive way, and for the campaign to be accessible. They came out of the idea of using posters, but also online resources, as obviously not all older adults have access to online, but some do. So we wanted to share posters within the community and also online resources. There was a great idea actually that was mentioned by one of the members of the network to put the posters on a tea towel, which we thought was amazing and really sort of focused the campaign to the older adults. However, sadly, budgets constraints wouldn't allow this, but we thought that was a great idea. During the focus group 1, the cartoonist came up with 3 designs, and during focus group 2, these were shared with the group. All agreed on cartoon versions, and then they advised us on how to distribute these and how to promote the campaign. This included older people distributing posters themselves within the Greater Manchester community. So what are the real benefits of this co-production, and how could you use this within your trusts and your organisations? By speaking to members of the Older Manchester People's Own Network, we raised awareness of the campaign in itself within that network. We then knew that campaign was going to appeal and to be relatable to older adults. And also those people felt a sense of ownership in their campaign, and they were therefore wanting to help us with the distribution and sharing the messages with their wider network as well. I'm just going to show you a video that we made as part of the campaign, and this then can be shared as a GIF on social media, or also can be shared, we had it up on billboards within Manchester as a GIF there. As I said, we also wanted to have this available in so many formats. So we created a poster, which is the Don't Brush It Under the Carpet poster. This says that help is out there, whatever your age, and talk to somebody you trust. And the ideas that came forward in focus group 1 were about brushing these worries and concerns under the carpet, brushing under the carpet you're anxious, sad, lonely, self-harm, grieving or depressed. We also created other images, and something they were really wanted to focus on was about being age proud and not focus on the image of an older adult as somebody who has grey hair and looks much older. we wanted to represent various cultures, various nationalities, and various age groups within the older age range. And doing this by a problem shared is a problem halved, and really focusing on talking to people, sharing your problems, and hopefully reducing those problems and getting help. In terms of disseminating the campaign, we had great outreach. We were featured on Northwest Tonight. One of the campaign members spoke there. We were featured in Granada News, so ITV local news in Manchester. All the local NHS Foundation trusts and mental health trusts produced press releases that were on their websites. We were featured in the Olden Times, and also in Talking About My Generation, which is a online newspaper produced by older adults for older adults as well. So in terms of a couple of comments from people who were part of the campaign, starting with Polly Kaiser, poor mental well-being is not an inevitable part in evading. And this campaign is integral in raising societal awareness of this and encouraging older people to seek help and not brush it under the carpet. And also from Jill Stainthorpe, who's a member of the Greater Manchester Old People's Network and who really kindly helped us throughout our campaign on our working group. She says this new campaign is really important because it is helping to break the taboo around older people's mental well-being and encouraging them to seek support. The campaign's strength has been the involvement of older people working on equal terms with professionals from the very beginning. Their voices have been crucial in shaping the direction of the campaign and raising awareness of self-harm and older people. And that's the message I'd really like you to take home from this presentation about speaking to older adults and involving them and their experience when shaping your campaigns and your policies within your organisation. I'd like to thank everybody. I'd like to thank NKISH, people from the Greater Manchester Old People's Network, including Liz Jones and Gillian Stainthorpe, Adele Owen from Shining Light on Suicide, and Polly Kaiser as well, and the Greater Manchester Health and Social Care Partnership for funding the campaign.